Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I will be discussing about a patient with heart failure so that we can assess the severity and the stage of symptoms. So here is a history. This is a 58-year-old male. His chief complaints were progressively worsening shortness of breath, especially on exertion for the last 1 week. He is having fatigue and generalized weakness and a low-grade fever also. His symptoms has been exacerbated by physical activity, especially when climbing stairs or walking uphill. He was in the past able to manage these activities without any difficulty. He had significant decline in his exercise tolerance. Activities that once caused minimal exertion, such as light gardening or brisk walking, now leads to profound fatigue and shortness of breath. Additionally, he described that he has difficulty in lying flat and often needs to prop up himself with two pillows to sleep comfortably. He has been frequently experiencing awakening at night due to breathlessness. He has to get up, go to the window, cough for a few times, and then the symptoms gets alleviated. He also notes an increased need for urination during night, and due to which he is unable to sleep properly also. In the past, he is a known case of hypertension, has been prescribed medications but was taking irregularly. He is a smoker with 20-pack history. His father died at the age of 55 due to myocardial infarction. Mother is healthy. And his siblings, one of the brother had undergone coronary angioplasty. He denies any recent fever but mentioned there is a persistent low-grade temperature over the past few weeks and occasional chills and night sweats. No history of recent dental procedures or skin infections. And this is the story of the patient. First thing, we'll try to identify what is the problem. His symptoms of breathlessness, fatiguability, and nocturnal awakening, suggestive of paroxysmal nocturnal dyspnea and history of orthopnea, definitely indicates that patient has got a left heart failure. These symptoms are consistent with a left heart failure. So left heart failure presents with symptoms of congestion in the lung. That is, they present with predominantly breathlessness. So now we'll look into what is the stage of the disease. This patient has got a stage C disease. Stage A means patient has got a predisposition or predisposing condition that produces heart failure. For example, somebody is having hypertension or a genetic background for cardiomyopathy. All these are examples of stage A disease. Stage B means there are structural changes. For example, a left heart patient with a hypertension has got a left ventricular hypertrophy. By echocardiography or ECG, you can say there has got a stage B disease. Stage C is symptomatic. So he has got symptoms. So you can definitely say this patient is got a stage C disease. Stage D means patient is significantly affected. Activities of life cannot be carried out. So he says stage C disease. Now going to the symptomatology, NYHA class of symptoms. He is he is unable to do ordinary activities, that is walking for a few steps. So you can say it is a less than ordinary activity. So this comes under NYHA class 3. If he is symptomatic at rest, we can say class 4. So as he has got some orthopnea etc., you may think that the patient may be going from stage 3 to stage 4. Stage 1 means more than ordinary activities. That is, ordinary activity will not produce any symptoms. More than ordinary activity produces symptoms. Stage 2 means ordinary activities. Stage 3 means less than ordinary activity produces symptoms. Stage 4 means symptoms. So this patient has got history suggestive of left heart failure, definitely, and he is having the underlying cause is coronary artery disease. The class of symptom, you can say it is a NYHA class 3, 4, and disease, he comes under stage C. So you can say this is a stage C disease with NYHA class 3, 4 symptoms produced due to coronary disease. And we have discussed the effect of heart failure on exercise tolerance, the changes in sleep pattern, and a precipitating factor probably is having fever, and the fever is due to, you should always rule out the possibility of infected endocarditis or some infections. The common precipitating factors for heart failure are angina or ischemia, arrhythmias, discontinuation of medications or non-compliance, taking medicines that can precipitate heart failure like NSAIDs, change in the dietary habit, excessive salt, increased fluid intake, and nutritional factors, especially intake of alcohol. So when a patient comes with heart failure, these are the points you should look for. What is the underlying disease? What is the stage of disease? What is the class of symptoms? And what are the precipitating factors? Hope it is clear to you.